For most of us, we never really give much thought to our heart as it happily pumps away. But for those individuals suffering from a cardiac disease, their whole world revolves around their heart's health. Southlake Regional Health Centre has evolved to be a leader in cardiac care in Ontario and worldwide. Joining us today is Dr. David Fell from Southlake to share some of the latest advances that Southlake is pioneering in treating heart disease. This is Daily WebTV. Stay with me today as I speak to Dr. David Fell, physician leader of the Southlake Regional Cardiac Care Program. Dr. Fell, thank you for being here with me today. I know that you are currently in position of third in all of Ontario for the Regional Cardiac Centre. What do you attribute that to?
Well, we have a tremendous team that's been established, Sheila, over the last 6 years that has been assembled. We've recruited some of the very best talent in the country to join our program. And there was a huge need for service in cardiovascular care in the York, Simcoe, Muskoka, Dufferin region. And so the program got started and we have a very excellent team. And I think the population growth has been incredible that the region has faced. And as a result, the demand for service in this area has been very high, and consequently we are serving a very large population and doing a lot of volume of activity.
You mentioned growing population, which is very obvious here in York region, but can we talk about the statistics of cardiac disease and actually what is cardiac disease?
Cardiac disease is a variety of diseases that affect the heart and the vascular system. It ranges from atherosclerotic heart disease, or hardening of the arteries, that occurs due to risk factors: smoking, hypertension, cholesterol, diet, exercise, genetic factors, and a variety of other risk factors that contribute to atherosclerotic changes in the arteries. The heart, as you know, is a pump. It pumps blood to the body. It's a muscle. It must be properly fed with a blood supply and oxygen. And so if it's compromised with obstruction or blockage in the arteries, then blood flow can't get to the heart muscle, and patients experience either angina or pain from the heart, or they may experience a heart attack if there's a complete blockage of the artery.
Now, I know there's a lot of new technology and advancements all the time. I certainly have heard of the electrophysiology labs or treatment, I think you mentioned. Is this actually something that can prevent or actually cure a certain type of heart problem that people have?
Our electrical team, or the electrophysiology team, is a group of experts that deal with the rhythms of the heart. And one can have fast rhythms, one can have slow rhythms, one can have faints, and they diagnose the type of arrhythmia. And then either through drug treatment or a special procedure that they have expertise in called ablation, they can cure heart rhythms by applying this innovative specialized technique, or radiofrequency ablation, to stop the circuit of activity.
Something like a CAT scan. I know here at Southlake Regional Cardiac Care Program you have the latest CAT scan, which, and you'll have to clarify this for me, 64 slices. What does that mean to me, the patient coming in for diagnostics?
The most advanced imaging now are a minimum of 64 slices, but even going higher than that. And it's really just a sophisticated imaging technique that is able to clearly define the anatomy and the structure and the problems of the heart. So that has excellent resolution now, and we are able to diagnose conditions that we couldn't have diagnosed in the past, and more importantly, help diagnose conditions non-invasively.
How much does a machine like that cost? Just curiosity.
Well, it ranges in price from maybe $2 to $5 million, depending on the
$2 to $5 million,
depending on the equipment.
And they don't last forever.
And the other important aspect is combining this advanced diagnostic imaging with our surgical techniques and with our intervention program. So new developments include a hybrid OR, which combines the talents of our cardiac surgeons, our interventionalists, as well as advanced imaging to make minimally invasive treatment effective for patients and not have to go through major open heart surgery where they have to open the chest. So we're getting more and more minimally invasive in our treatment strategies as we move forward into the future. But combining that with the imaging has been essential.
Any other new advances or things that we're looking forward to?
I think what we're looking very much forward to in the future in both surgery and in intervention is the minimally invasive approaches. So putting valves in that don't involve opening the chest. So putting valves in by catheters with the help of imaging techniques.
Right.
And small incisions that are made or keyhole type of incisions that enable minimally invasive approach to the heart. And it's becoming a full reality in the major centers around the world and at Southlake.
That's very interesting. Obviously, a terrific benefit to the patient as far as recovery and must dramatically decrease the risks of infections, etc.
It has huge impact. The length of stay is very short with these procedures. And what we have to do, though, is clearly show their superiority, and that is taking place with the new trials that are going around the world looking at this. But we're very excited about these developments. Another very major area is managing and monitoring patients when they're at home. So whether they're close by in the community or far away in the region, we're able to monitor and assess them through remote monitoring abilities. Patients who have defibrillators or shock devices or pacemakers can now be interrogated remotely through online, and we can interrogate their equipment while they stay at home. And this is also a very important development that's happened. In fact, Southlake was one of the world's first to establish remote interrogation and monitoring of a defibrillator. And we're very excited about this development, and that's the way of the future.
Dr. Fell, I understand that Southlake is one of the world leaders in heart attack management. Can we address that for a minute?
Yes, we're very excited by the expertise offered by our team in the management of heart attacks. These are patients who have sudden severe chest pains and they've blocked an artery. And 911 is called, and one of our experts, who's the medical director of our program, has been a world leader in the management and system management care of these patients. Patients are given either a thrombolytic drug in the field at their home, a clot buster, or they're brought immediately to the cath lab in a trial that's going around the world. And we are one of a few centers in the world that are doing this trial. In addition to that, we've been a leader in the implementation of a standard of care now accepted worldwide. That is, patients who present to a local emergency department will get a clot buster, but the state of art now is to immediately transfer them to an advanced cardiac center to have heart catheterization to immediately open that artery up if it isn't opened, with a stent and angioplasty. So this has developed what's called the pharmacoinvasive strategy, and our team has been instrumental with other leaders in the world to have this implemented.
So I imagine time is of the essence in this.
Time is muscle. Time is whether you live or die, and also whether you have ongoing problems. So the sooner you are managed, the better the outcome. And so our whole emphasis is getting that artery opened as quickly as possible. And heart catheterization with angioplasty and stenting is the state of the art, so it's a matter of getting that person to the lab very quickly. If they can't get to the lab quickly, then we go to the clot buster to treat initially and then transfer that patient to an advanced cardiac center.
Dr. Fell, thank you so much for this fascinating information.
Pleasure.
If you'd like more information about the exciting advances at Southlake Regional Cardiac Care Program, please go to southlakeregional.org. Keeping you informed, I'm Sheila Clark, and you've been watching Daily Web TV.